Professor Glaser, if I am double vaccinated, can I still get COVID?
The double vaccination, I think, is very necessary, although we must remember the discussion that was had worldwide that Pfizer and Moderna, the mRNA vaccine technique, were recommending vaccinations at 3 weeks apart, and they used that model, or at a maximum of 4 weeks at the beginning of the epidemic. We then found that the Joint Committee for Vaccinations in the United Kingdom decided that they would vaccinate the maximum number of patients and vaccinate at 3 month intervals. And it seems that the actual outcome is going to be the same. So I think if you've had the first vaccine, there is a great advantage of having the second vaccine, whether at whatever interval, because the first vaccine produces some immune response, both antibody and T cell response, and the second vaccine increases that response. But no matter what interval and how many vaccines, I think the word that people, virologists use is a leaky vaccine. These vaccines, both the mRNA and the DNA vaccine of DNA science-based vaccine of AstraZeneca, both of these vaccines may not produce lifelong immunity. And this is fascinating and unique about this vaccination campaign worldwide, that if you get vaccinated against polio or you get vaccinated against chickenpox or measles, usually vaccines produce lifelong immunity. We are now seeing, after 6 months, people, even after the second vaccine, are getting the disease. But we believe they are still infectious. And now many countries in the world are talking about a third booster vaccine. So there's no doubt the two vaccines are essential, because we have to make a start if the philosophy is to mass vaccinate whole populations. Now, there are other views about who and what and how and which populations should have been vaccinated. This was just one way of dealing with this pandemic. So the answer is yes, the two vaccines are important if one follows this philosophy of vaccinating the whole population, including 12 to 16-year-olds. Well, there are two schools of thought. The majority thought is that you can vaccinate out of a pandemic. So you vaccinate the whole population, and that population eventually, the vaccinated population, together with those who contract the disease, will eventually initiate a situation called herd immunity, where everybody's going to have some ability to be immune from the disease, or they're not transmitting the disease, so the few people who are not immune will not come in contact with people where they can catch the disease. So this herd immunity idea is the aim of this philosophy. Now, the second idea is that you just take and immunize the vulnerable people. So the vulnerable people we know are the people over 80, perhaps over 70, the people who have diseases which cause them to be weak and prey to viruses. They're immunodeficient people, and of course, people who have diseases that make them immunodeficient, such as cancer sufferers, such as people with other diseases where they have a lowered immunity anyway. So you just take that group of people, you vaccinate those people because they're the likely people to get the disease, you leave everybody else, you leave the rest of the population, but in that rest of the population, you're going to get some people who are going to contract the disease. Now, those patients probably are likely to recover. So you would use normal clinical methods, which we have got better at in treating this disease. You would give them antiviral agents, you would give them anticoagulants so their blood doesn't clot due to the adversity during the disease. You'd give them steroids so they wouldn't get abnormal overimmune response, which is very dangerous. The hyperimmune response is what has been killing the patients with COVID. So you would do two things. You would focus on the vulnerable, and you would treat clinically, as with any other disease, those who caught it, and the rest of the population would go on. So what you would try to do with that philosophy is turn the COVID epidemic into a flu epidemic. So you would still get from May to October patients getting it, but gradually the virus, and I think this is a very interesting point, the virus wants to survive. If the virus kills everybody, it doesn't survive. So the virus would become infectious, but it wouldn't become as harmful. So there's these two philosophies. One, you make everybody immune by vaccination, or you just pick vulnerable groups and treat the other people. Now, which is right, I don't know, because only history will tell. There's no doubt that adopting this mass vaccination program and lockdown program, we have altered the very structure of living, being, family, work, and society.
Professor Glaser, should I let my child or teenager be vaccinated?
This, I mean, there now is almost a consensus view that in the United States, the United Kingdom, in Israel, which was at the forerunner or the first country to have mass vaccination, that 16-year-olds certainly, and possibly children as young as 12 should be vaccinated. Now, the reasoning for that goes, one, if they do get the disease, they miss their schooling, they miss their education, so you don't want that. Two, that the children are carriers, that they don't get so ill, or they don't get so ill as the 80-year-old or the 70-year-old or the sick person with the virus, but they do carry it and give it to other people and give it to people in their own families. So one you don't want them to get it, although they still may carry the virus and transmit it to their family and their surroundings. But there's a lot of evidence also says that the incidence of inflammation of the heart, which we call myocarditis or endocarditis, may be a factor. So one has to balance side effects with vaccinating. And I think on balance, the incidence of myocarditis and endocarditis is pretty low as we see it at the moment. Now, if we see that many 12-year-olds to 16-year-olds are going to develop this complication, then obviously the balance is going to go not to vaccinate them. At the moment, I think parents with the philosophy that has gone on, the historical philosophy over the last 18 months of vaccinating the whole population, on balance, it is right to let the 12 to 16-year-olds be vaccinated. Thank you for listening. I hope you found this interesting, and if you did, please subscribe.